it's Bonnie Southgate from Pilates Therapy. I am going to show you a couple of screens for the knee today. We are looking at the Valgus and Varus stress test, which is testing the two ligaments on the outside and inside of the knee. We're testing the medial collateral ligament and the lateral collateral ligament, which holds the tibia and the femur together nice and securely, and helps stabilize the knees. So we're going to look at the medial collateral ligament first, and what we're looking at is excessive movement or gapping of the medial side of the joint if there was a problem with that ligament. So your client or your patient is going to be lying in their supine position. I am going to start with taking my hand on the lateral portion of the femur, and then I'm going to take my other hand on the lower part of the tibia. I'm going to laterally or externally rotate the lower leg, and now I'm going to hold pushing the femur in, and I'm going to pull into abduction with the tibia. And what I'm looking at is a gapping on that inside of the knee, and her knee is absolutely fine, so I'm not getting any movement. And then we need to take it into 20 to 30 degrees of flexion at the knee. So I'm just going to put this under her knee and have it sit there. That might need a little bit more on top of it. So we'll give her a little bit more. So if you've got a bolster, that's a little bit easier. Mine's not here today. So it's going to be the same thing with the hand positioning. I'm going to take my hand on the lateral portion of her femur, and I'm going to take the leg and I'm going to externally rotate that leg. I'm going to be pushing and pulling the lower leg. So you can see there's a bit more movement at that point in her knee inflection, which you would expect. And you're really looking for pain or a big gapping of that movement. So that is to look at the medial collateral ligament, or that is the valgus stress test. So this time we're looking at that lateral collateral ligament, and I'm going to have to fix the femur on the medial side, or inner thigh of the leg, and I'm going to take the hand. Again, I'm going to externally rotate the leg, and now I'm going to be taking the leg into adduction, a deduction, because I'm trying to gap the outside of the knee. So I've got that there. I'm fixing her here, her femur here, externally rotating, and I'm pushing that leg in, looking for a gapping on the outside of the knee, which she seems fine with. And again, we're going to take some cushions under that knee. So it should be 20 to 30% of flexion with the knee on the second part of the test. And again, I'm fixing the femur there on the medial side. Take that lower leg, lower portion of the tibia, externally rotate. I'm going to push with my hand on the femur, and I'm going to then also push the tibia in, and I'm going to look for a big excessive gapping or a lot of movement into that lateral side of the knee, which feels nice and firm. So that is your stress test, your valgus and your varus stress test for the medial and lateral collateral ligaments. If you found this interesting, then you can find out where to learn this, or you can check out more. We've got more videos looking at lots of different screens on www.pilatestherapy.co.uk.